For regulated health professionals, the scariest correspondence they will receive will come from their college. Perhaps the second scariest will come from an insurance company asking for information about the services for which they've billed. Now, whether that insurance company is the Provincial Health Insurance Plan, OHIP, or a private insurance company, responding to inquiries from the insurer in a careful manner can make the difference between a limited inquiry and an expansive audit. Getting advice from the outset is crucial. The first step in responding to an inquiry from an insurer is to identify what records are at issue and what the concerns may be. Now, you're unlikely to be informed of the concerns at this phase, but if you are aware of a patient complaint or a concern, or if you identify a pattern with the records requested, that might give you some indication of what they are after. Review the records before you provide them to ensure they're complete. If the records are not complete, do not, I repeat, do not alter them or do anything else that is inconsistent with your professional obligations. Rather, identify what is missing and any reason for that and provide that to your lawyer. Typically, at the first phase, the insurer will simply request records. Unless information is missing that requires an explanation, no explanation should be offered at this point. You probably don't even know what the issue is. If you're asked for an explanation or a response, get assistance before submitting one. You're too close to provide an objective assessment of a concern. When you do respond, adopt a tone of being respectful and helpful. If you're going to be interviewed, again, get assistance. Even if you're nervous, you do not want to appear to be hiding something or to be combative. Insurers have the right and arguably the obligation to inquire into irregularities, so challenging their right to do so is unlikely to be effective. If the billing was appropriate, then the response is your opportunity to identify why it was correct, even if the records didn't appear to support that claim. So you might look to imaging, or other records not provided, or recollections of staff in your office, or anything else that will support your explanation. If there's a dispute about a fee code that you used, the support of an expert who may be a colleague might be helpful here. If you've identified errors, you'll want to work with your lawyer to develop a plan for addressing these errors. Insurance, in our experience, don't just want to be reimbursed for funds paid improperly. They want professionals to demonstrate insight into the errors they may have made and to see a plan for addressing these going forward. In this way, insurers are not unlike regulators, and the response to inquiries from the insurer may be similar to responses to a regulator. If there's a repayment to be made, there's often the opportunity to negotiate or propose a repayment plan. For most professionals, the ability to bill an insurance company going forward will be more important than the amount of repayment at issue, but preserving the right to bill the insurer going forward requires a careful response and addressing the past concerns. Remember as well that insurance audits can and often do lead to regulatory proceedings. How you handle the request from the insurance company will have a significant impact on whether regulatory proceedings will follow. If you're the subject of a billing audit or inquiry, make sure you get advice before you respond. Call us at Rosen Sunshine. We've helped lots of professionals through this process, and we're here to help you.